Okay, so those are our metrics. So infant or child mortality rates, life expectancy, health adjusted life expectancy, and disability adjusted life years are metrics that we're going to use to get an idea of overall health at the population level. And then the next issue becomes, how do we present health information? Okay, so one of the ways that we can communicate health information pretty powerfully and can tell a really good story of what's going on is by using graphics. So bar charts, line graphs, pie charts, all different types of graphics and infographics as well can be extraordinarily helpful at conveying information in a way that helps foster understanding and demonstrate meaning. But it's going to be really important that we do it accurately. But let's just take an example of how this would work. And yes, my clothing is different. My mom turned 80, and so we're taking her out to an outdoor restaurant for lunch. Okay, because we are not in Wisconsin. Okay. So if we look at the data, for example, that you all saw for COVID for Dunn County, there's an incredible amount of information here, but just looking at it in this format is not particularly helpful. So perhaps I want to try to represent it graphically in order to demonstrate some of the meaning behind that. One thing I could do is create a bar chart of the number of new cases diagnosed per day. And so this is a bar chart of exactly that, looking at the number of new cases diagnosed per day. And it's okay. You can definitely see that things are trending up as we get into November, especially. But you can also see that there's a lot of variability. You can see about every 7 days there's a really low bar, right? So that would be Sundays usually. And so anytime there are daily counts of things, stuff that comes in on the weekends, when there are fewer office people around, or perhaps when less testing is performed, we kind of see these artifactual dips. It's not a real reflection of oh, did fewer people have COVID that day? No, it's just we either had fewer cases that were actually diagnosed or reported because of the work week. Right. We also see this, of course, with holidays, which we're seeing quite a bit of now. We get a lot of distortion of the data. So looking at daily counts isn't super helpful. And also, if we want to look at trends over time, maybe instead of a bar graph, we want to use a line graph. So this is a line chart of the 7-day averages of daily new cases. So one of the columns in that database is the 7-day average of daily new cases. So they take the previous 7 days, add them all up, divide them by 7, say on average for the previous 7 days, this is where we were at. And as you can see, this is much more helpful. So we can see back in January of 2021 that we were averaging about 20 cases a day in Dunn County. Then come September, we were averaging about 30 cases a day. And then in November, we were averaging about 50 cases. You can also see a lot of noise happening in the line graph in later November, and then we'll see that again in December because of holidays, right? And that kind of screws everything up when you have Thanksgiving. Also, we can see a lot of noise in the data anytime there's a huge testing drive, right? So there are certain days of the week when there's massive free testing available at certain locations. As members of the Stout campus, you've had regular access to convenient on-campus testing, but for a lot of people in the community, they'll wait until, next Monday is a big testing day. So we also see some noise in the data from that. Now let's say, so this tells me the story of the increasing incidence, right? Increasing number of cases diagnosed in a period of time in Dunn County, especially compared to this summer, right? And definitely compared to last year in January. November is not on here, but if it were, you would see that this November is even a little bit higher than last November. Let's say I wanted to say, how is Dunn County doing compared to the other nearby counties in the Chippewa Valley? So this line graph is again looking at 7-day averages of daily new cases, but comparing Dunn County to Chippewa County to Eau Claire County. And you can see that we all have followed the general same pattern. but that, gosh, look, Eau Claire is so much higher in general, most of the time, than Chippewa or Dunn counties. And in fact, Dunn County seems to have the lowest case numbers. So the unsavvy data analyst or consumer of information might say, oh, well, gosh, Dunn County must be doing something right because we're having far fewer cases of COVID. But you all now are much more savvy, and so you would say, wait a minute, what's the population of Dunn County, right? Are there fewer potential people in whom COVID can even be diagnosed? And of course, the answer is yes. So the population of Dunn County is about 45,000, Chippewa County is about 65,000, and Eau Claire County is about 105,000. So you all know that we're supposed to adjust for population. So if we do that, and we adjust for population, right? So this is average, 7-day averages again, but per 100,000 population. So we're looking at the 7-day average incidence of daily incidence of new cases in these different counties. You can see actually that Dunn County is doing the worst in terms of, last April, you can see our incidence rates per population were much higher. Then you can also see that in November, certainly, our rates were much higher in Dunn County. And so we can then say, okay, distribution of disease. So if we're thinking about our PERI from last time, our etiology, like what's the problem and why is this happening? What's the cause, contributory causes of this? We could say, okay, what other things are different between Dunn County and Eau Claire and Chippewa counties? And you might say, well, gosh, maybe vaccination rates are different. And you would be correct. So we would look for potential contributory causes like that. Okay, so this allows us to give a more accurate comparison. So that previous slide, if I had published that as, in a scientific publication or a news article, that would be misleading, right? You want to adjust for the population. Here's another type of chart. So this is a pie chart. And so a pie chart, of course, is showing you the relative slices of the pie of the different categories within the whole. I think that's a garbage truck. So my apologies. Okay, the garbage truck has moved on. So this is really useful at looking at what proportion of overall whatever it is distributed among the different groups. So for example, this is deaths for Dunn County. And so we have two different pie charts here. This is due to COVID-19. So as the one on the left is the total deaths from COVID-19 in Dunn County as of March 3rd, 2021, there were 31 deaths. And then the one on the right is for December 22nd of 2021, at which time there were 58 total deaths. So on the one on the left, you can see the proportion of deaths that were in different age groups. Now at that time, as I had mentioned earlier, we didn't have specific data on the age groups of those people who were less than 70. So they're kind of just all put together. Excuse me. But now in December, we have had additional deaths in those age categories. So they're giving us more specific information. And so that you can see, we can now subdivide it out into the 60 to 69 and the 50 to 59. We have enough data to be clear about that. But then the under 50s, again, we don't have specific enough data, again, because we want to maintain privacy of those individuals. So what's interesting about this to me is in these 9 months, right, we've seen a significant growth, and you can see this visually by looking at the two different pie charts in the percentage of people under age 70 who have died from COVID, right? So in the graph on the right, let me use my little highlighter here, right? So this whole chunk, right, was previously represented by just this chunk. So what we're seeing is an increase in the proportion of deaths that are occurring in people under age 70 that's happening in Dunn County over time. And this in many ways makes sense based on other information that we know, because we know that people who are over age 65 are vaccinated at a much higher rate, even in Dunn County, than people under age 65. So the fact that before vaccines were available, widely available, in March, we saw most of the deaths were occurring in people, so about 80% of the deaths were occurring in people age 70 and up. But now that vaccines are available, only about, let's see, 2/3 of all deaths have occurred in people aged 70 and up. So we're definitely seeing changing distribution of disease, right? And so, I've kind of already given it away that probably a big reason for that is vaccine availability. If it could be something like, oh, now the disease is more severe in younger people, right? There could be other explanations. That sometimes happens. So pie charts can be really useful. So I just want to give you a few more examples, and I'm really hammering this home because graphics can be really powerful, but they need to be accurate and they need to be appropriate. Otherwise, they're extremely misleading. So I'm going to show you some examples of some good and some not so good graphical representations of data to kind of hammer this home a bit more and help you to be a really savvy consumer of data. So this is one that I use in one of my other classes as well. So this is a graph, a line graph, showing you the numbers of abortions and the numbers of cancer screening and prevention services performed by Planned Parenthood. If you look in the lower right-hand corner, you'll see that the source of this is Americans United for Life, which is an anti-abortion group. So you're going to know right from the onset that this is a group that might have a particular bias that would influence how they would present this information. So we're going to take that into account. But as you look at this graph, right, initially you're like, oh my gosh, abortions have gone way up and cancer screening and prevention has gone way down. You'd be like, oh my, what is going on with Planned Parenthood, right? They're just focusing on doing all abortions. Look, they're doing more abortions than they are doing cancer screening and preventative services. This is, and if you're someone who doesn't favor legal abortion, you'd say, well, this is a travesty. This is horrible. They're not doing the things that we think they should. If you look a little bit more closely, however, you'll notice some significant errors in how this graph was composed. So for the abortions, they went from, gosh, I don't have my reading glasses, so about 289,000 to 327,000, right? So an increase of maybe 30,000. The cancer screening went from 2 million to under 1 million, right? So the scale of these things is completely different, right? And so the abortions, ended up at 300, almost 330,000, right? And then they've got that higher than 900 some thousand. So the problem here is the axes are all off, right? And so you cannot accurately portray how one of these relates to the other if you're using these cockamamie axes and kind of positioning like this. So the editors over at Vox, VOX, which is a news organization, media site, who often does some really great data visualizations and graphics, said, okay, let's look at these numbers and let's create an appropriate line graph. And this is what it looks like. So now we can see on the axis, it goes all the way down to 0. So that's something you always want to check. And it goes up to 5 million. So our y-axis on the left, let me just draw your attention to that. So all the way from 0 up to 5,000. And so they said, okay, well, let's look at cancer screening and preventative services. And in fact, yes, they significantly declined from 2006 to 2013. And so you might say, well, that's preposterous. Why aren't they doing that? That's potentially life-saving interventions. And this is one of those things where you really need somebody who has subject matter expertise to be able to interpret the data. So I will tell you, as a healthcare provider, the reason why that changed is between those two dates, the guidelines for how often pap smears, which are a screening test for cancer, should be performed, changed from once a year to once every 3 years. So any health organization that is following the new appropriate recommendations will see a decrease in their cancer screenings to 1/3 of what they used to be. So this is actually absolutely appropriate and good medical care. So there's that. Then if you look at the abortions, now that it's on the same axis, you can see that although yes, there was an increase in the total number of abortions performed, it is a relatively small increase, right? What you can also see on this chart, which helps put things in better context, is the other services that Planned Parenthood offers. So STI testing and treatment and contraception, which far and away eclipse their abortion services, which are actually a very tiny proportion of what they do. So this is a much more accurate representation of what's happening. But let's say, well, I'm really interested in the fact that abortions have been increasing. So what's that all about? I'm going to show you. Here is a chart that is good and bad. So what this chart is showing us is, and the thing that's good about it, is it's telling us the rates per 1,000 women. So the reality is that in 2013, so thinking of the previous graph, in 2013 versus 2006, there were a lot more women of reproductive age, which is generally calculated as ages 15 to 44. So there were more women. So there were more people who could potentially have abortions in 2013 than there were in 2006. So yes, the total number increased, but what about the likelihood that any individual person would choose abortion? Well, that actually decreased. So when you look at the rate, when you control per population, when you adjust for the population, what you can see is that abortion rates have actually been steadily decreasing. And this particular chart ends at 2014, but this trend has continued. 2019, we had the lowest abortion rate ever in the history since we've been measuring them, when abortions became legal in the United States in 1973. So this graph is really helpful because it shows us rates, right? Is it really becoming more prevalent, or is it just that there's more people around? And so, and so it turns out that there's just more people around. So the total number of abortions during that time period in the previous graph did go up, but the actual rate per person is down significantly. So now I want to highlight something that's not good about this particular graph. So if you look at this graph, this red line is the rate of abortions. The blue line is the birth rate, so the number of births per 1,000 women aged 15 to 44 per year. And the problem here is that this chart makes it look like there are more abortions than births, which is false. So if you look at what they've done, they have two separate axes. So they have birth rate over here with its own scale that doesn't go to 0. And then abortion rate is over here with its scale, which does go to 0. So if we look at 2014, for example, it looks like the abortion rate is higher than the birth rate, but it's not, because the abortion rate is about 15 per 1,000, whereas the birth rate was about 64 per 1,000. So it's 4 times higher. So this particular chart gets a nod. It gets a check plus for using rates instead of absolute numbers. So that helps us control for the changing size of the population over time. But a big demerit for using different axes, because it gives a very misleading picture of what's going on. Okay, so this is another example of a graph or a chart which uses two different axes, but what you'll see is that in this case it's actually appropriate. So we're looking at cases per month and hospitalizations per month in Dunn County during the Delta wave. So month 1 happens to be July, and then this particular graph runs through month 5, which is November. So what you can see is it's a combination graph, so we have both a line graph and a bar or column graph. So the line here, right, is showing us the number of cases diagnosed in each month, and the axis for that is over here. So you can see that in November there were approximately just shy of 1,300 cases, maybe 1,250 cases diagnosed in Dunn County. So that's we've got that axis over there. And then for the bars, the columns, we have the axis over here on the left, number of hospitalizations per month. And so this is an appropriate use of two different axes, because otherwise all of the bars would be teeny, 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 tiny, because these numbers are so much lower, and you wouldn't be able to see the differences between, say, July and November if we tried to put them all on the same axis. So this allows us to see the difference in the columns and still see the relationship, see that there's a proportional relationship to the number of cases, which was pretty well maintained actually for the previous 3 months, the last 3 months, but that we're not trying to compare the absolute number of cases to the absolute number of hospitalizations, right? Because we can't when they have different axes, but we can see the ratio and that there is a relationship there. Okay, so always check your axes. The last thing you want to do is check for quality. And so in this age of misinformation, sometimes intentional and sometimes not, you really need to look hard at the information that you're being presented with, because a lot of it sounds really good and really convincing, and it's really wrong. And oftentimes it's really wrong in subtle ways that can be really difficult to pick up if you're not someone who has training in understanding graphs and how we represent data. So hopefully now you all have a bit of a feather in your cap. You have a bit of an advantage now. You know some of the things to look for. And then in the textbook, there are some additional things that you're going to look for anytime you're using a particular website as a source of information. That's going to become important as you work on your final report for this course. You're going to choose a disease or a condition in a certain region or time period, and you're going to evaluate it in all the different ways that we're talking about in this course. So finding reliable sources of information is going to be important. So I'm going to let you read that in the textbook. You don't need to hear me say it. And because I've already been talking for almost an hour and I'm not sure if you're still awake. So let's wrap this one up. So far for part one here, we've talked about the scope of health communications, right? So collecting data, compiling the data and analyzing it and then presenting it is the first three, and then perceiving it, combining it with other information, making decisions based on it is the second three. So this part one focused on those first three. So where does the data come from? We talked about the 7 S's. The metrics that we use to measure the health of a population, so childhood mortality rates, life expectancy, health-adjusted life expectancy, and disability-adjusted life years, and then how we present health information. And again, I gave you just a little tiny snippet of ways to look at graphics in particular. We could talk for an entire semester about effective ways to present health information. There's an additional box in the text called kind of the success method for presenting health information, which is kind of a marketing 101. And as you'll see, much of the misinformation that's out there about COVID, for example, gets those things right. So it's often very effective information. It's just unfortunately often very inaccurate information. Which makes it all the more frustrating that it's so effective. Okay, so in part two, we'll take a look at that second half of the equation, the receiver side of the health communications, how that information is perceived, how it's combined to make decisions, and some examples of different ways of decision making in healthcare. All right, everyone, thanks so much for your attention. I'll see you in part two.